So how do we make this LEDs? They usually are made from the blue LEDs. So the main thing is first you make a blue LED and then you cover that with a yellow phosphor. So once you cover that, so when you like bias that LED or pass a current through the LED, it emits the blue light and it excites the phosphor and gives a whole broad spectrum. So once you get this a broad spectrum, so this shows a light or a white light. Again, the white light can be either a cool white or a warm white. So if you look here, so if we have a yellow component more, then it becomes like a warm white. And if it is like a more of blue and less of yellow, then it's a cool white. Now these LEDs are now like all the smartphones or even a simple phone, they have these LEDs or a flashlights. So all of them are made from the 3 nitride. Other than that, with the same material, we can also make UV LEDs. So in the previous slide, what we were talking about was mainly on a visible region. UV is in a shorter wavelength. Is a shorter wavelength. So this can be used for disinfection, and it has a lot of applications in the biomedical field. Other than that, like maybe around 10 years back, we were using silicon for most of the devices. Now, the paradigm has shifted towards gallium nitride or 3 nitride devices with silicon carbide. So now, like whatever you like, if you have a mobile phone or a charger, so all these are made from this gallium nitride based devices. And if you look here, so this is a simple charger that is used for this charging of this laptop or any electronic devices. So it always have a small component of gallium nitride. So another one where we use here is audio amplifier. So in this amplifier also we have this transistors or power devices which are made from this gallium nitride device. Other than that, we are moving towards this photovoltaic devices. As you know that the solar cells, they convert the solar energy into an electrical energy, and then we need an inverter to convert that DC to the AC source. So in that case, we require that inverter and all the power components. Like what we have here is a diode or a power transistor. All this are made from this again a 3 nitride device. Other than that, we use this for the EV, electric vehicle, or now we have like a heavy electrical vehicle, like what we get is car that is operated on batteries. So all this now they are using this gallium nitride. They don't use silicon because they require high power and high what do you call high voltage devices, and silicon can't sustain at that voltage. Then other than that, we have UPS. So all the UPS have this power transistors and all that. So the voltage range for this EV is around 600 volt to 900 volt, and when we go to around 1.2 kilovolt, then again the 3 nitride based gallium nitride based devices are needed. Again, if you we need to go for this 3.3 kilovolt to 6.5 kilovolt, then a silicon carbide based material. And again, there is a possibility that on silicon carbide, gallium nitride will be there, or 3 nitride devices will be there. So this is being used now widely. Other than that, this has been used for the solar cells. Like it's still in the research stage, not in the full product. So since the indium gallium nitride this covers the whole visible spectrum or the solar spectrum, so this is a very good candidate for the solar cell. but due to the materials, like the defects in the materials, still it's not been commercialized, but it's a very good candidate to replace the silicon-based solar cells. Now I will come to the applications of 3 nitrile devices for this uh, biomedical application. So first is the LED phototherapy. If you want to ask any question, you can interrupt me anytime. So you might have heard of this, like there is a thing that occurs mainly in the infant, and most of them, like most of the kids born in India, they have this one. Once they are born, they have this neonatal jaundice. So since infant or a kid is born, then it usually in the Indian environment, or he faces this neonatal jaundice. So if it is not treated, it can cause a irreversible brain damage, and also it causes death. So usually in the olden times, we used phototherapy equipment for treating the uh, small infants. So that usually that type of equipments were very bulky, and it consists of an expensive bulb. And it used to, like, if you were having that bulb, so it used to like get fused, or it has to be frequently replaced. And especially if you are staying in the rural areas, it's very difficult to have this material or this bulb available over there. So the thing is, with the conventional system was the shorter lifetime, and again it was expensive. Now this has been replaced with the help of this LEDs. So if you look in this picture, here there is an infant, and that is treated with this blue LED lights. So once you keep the kid in this light, what happens is all this his yellowness, that yellow due to jaundice, the yellowness, it goes it's like it goes out gradually. So these LEDs can replace the conventional bulb because they are like cheap, and they have a long life. And other than that, LED have been specially selected. Like you can just select or if you for this disease you need a particular wavelength. Now in this case, the dominant wavelength is 458 nanometers. While in this, if you have a bulb, then you don't get a particular dominant wavelength. There would be a multiple wavelength. So here we can just put a dominant wavelength on a baby, and in this way we can maximize the rate of value being breakdown. Then one more thing is the arrangement of the LED along with the optics have been designed to provide a uniformity of light on the patients while minimizing unwanted spill and glare outside the treatment of the surface. So once you have this LED, then the light can be confined to a particular area and can't spill out. So this is also a good advantage of this LED. So one of the good application of this 3 nitride material is that of a blue LED that has been used for phototherapy and to treat this jaundice. Now, another application is to treat the acne. Now, usually, I think in India, most of the people, like once they go into adolescent, they get those pimples on their face or acne. And this is mainly due to the pollution, and also depends on the diet habit and all that thing. So in this, now there are a lot of pharmaceutical companies. They have a very big market in that, and they use like a lot of creams and all that. And they use like a lot of people, they use creams to treat this acne. Even they are using like chemicals also. So that might be harmful. So one of the best way to treat this is with the help of a phototherapy, again with the blue light. So if you want a clear, brighter skin with fewer breakouts, the blue LED therapy is an effective treatment to battle against acne. So blue LED light penetrates beneath the skin to calm and regulate the sebaceous gland. So this is a good thing, which is uh, this acne is usually caused due to the sebaceous gland overdrive. So the thing when the blue light penetrates in on your skin, it what it does is it regulates that sebaceous gland and it it avoids the growth of this acne. Blue light acne phototherapy promotes the creation of powerful oxygen molecules within the skin, which have the ability to quickly and effectively destroy the acne causing bacteria lurking therein. So this is also very effective in killing the bacteria that is present inside the acne. So this is a new technology that the people are focusing rather than using the medicine or the chemicals uh, to treat this acne. And this LED is will be having a very huge market, especially in terms of India, where we a lot of people face this problem. So, as I said, unlike other acne treatment, it doesn't result in dryness or discomfort. Yeah, so if we sometimes when you put this medicine or on the acne, there is like irritation or sometimes there is a swelling or pain. But with this light, there is no dryness or discomfort. Uh, and with the case this with the topical medication and do not cause any side effects. And this blue LED doesn't contains any UV light that can danger the skin either. So this is a particular advantage of this blue LED, and that can be used for phototherapy for acne treatment. The third use of this LED lights is for the treatment of SAD, that is seasonal affective disorder. I don't think like this type of disease is. I think this is less relevant here in India. It usually happens when there is a change in climate. Like now we are moving from like summer or a hot weather to the winter. So during this change in time, there is always a disorder or a change in mood. Or this is called as a seasonal affective disorder. So once you are moving from like hot weather to cold weather and cold weather to hot weather, there is a change in your mood, and this results in a seasonal affective disorder, and this is usually results in depression and due to the change in season. So these are the symptoms. The few symptoms are feeling of depression that comes and go at the same time each year. Usually starting in the fall. As I said, now we are in the fall and winter, but in some cases in summer. And another symptom for this SAD is a lack of energy, feeling of fatigue, and lethargy, sleeping more than usual. So it usually happens like when there is a change in weather or a season. Like in winter, you sleep like more as compared to that of summer. And the third symptom is increased appetite. Like you eat a lot, and sometimes it can be accompanied by other causes. Now, how to treat this SAD? So, if you look at this yellow graph, so this is a daylight, and it's this daylight covers the whole spectrum. So if you look here, so this is covering the whole spectrum of light. So it's like whole visible region from 350 nanometer to around 750, and it goes further. And the standard full spectrum is this one, the red one, where we have some peaks like around 400, then 420, then we have this around 550. So we have a peak wavelength in between. And this is but the main effective wavelength for treating this disorder is in the range 470 nanometer to 490. So if we have any source or a light which is in the range of 470 to 419 nanometer, then this will be a very good way to treat this seasonal affective disorder. So the only way to make this LED is with the help of 3 nitride materials. So you can easily make uh, the LEDs with the 3 nitride materials, and the material will be indium gallium nitride. And you can change or you can have a wavelength brought in the range from 470 to 499. So this is the spectrum that will be very much effective for the seasonal affective disorder. Other than that, we can also use the white light source. So as I said earlier, the white light is made from the combination of blue and the yellow phosphor. So here if you look, so this is a blue LED, and then we cover it with a phosphor. So this is a commercial white light source which is used for the treatment of seasonal affective disorder. So this light therapy is very much helpful for the treatment for around 50 to 80% of the people with SAD. So in order to treat SAD, the light box needs to have a minimum power rating of at least 10,000 volts. So the bright light, which is about 5 to 20 times the amount of normal indoor light, has been shown to reduce the symptoms of SAD. So this has been there has been a lot of research on this, and it has been found that if you have this white light source, so this will reduce this seasonal affective disorder. So if you look at this picture, so the commercial lights are available, which will give you a white light or a blue source, which will be helpful in treating this. So other than that, phototherapy can also be used for the treatment of circadian rhythms. Now, what is circadian rhythm? So, circadian rhythm is our physical, mental, and behavioral changes that follow a daily cycle. So, sometimes, it's a change in what do you call it? Your mood or something that happens. They respond primarily to light and darkness in organisms. So it usually happens on all the organisms. It's not only humans, but all the organisms. Like if you don't give light to the plants, so they will become like yellowish or something like that. So similarly, for all the organisms, the light is important. So light plays a very important role. So even one of the main symptom of this circadian rhythm is sleeping at night and being awake during the day is an example of light-related circadian rhythm. So what happens is like in the night you are not able to sleep, and it usually happens like to most of the people who are having like not what you call a stress and all that. So they don't get like a proper sleep at night. So this can be treated again with the help of a phototherapy. So the new technology has emerged. So with the research in circadian rhythm dysfunction has opened the opportunity to apply therapy using blue spectrum light to help to reset the body clock. So if you just have an exposure to this blue LED light, if you look here, if you have this type of exposure. So this will be helping to reset your body clock, and after like one or two exposure, you will be able to get a proper. So while most visible wavelength on the light spectrum can reset the body clock, the most effective way to alter circadian rhythm is using a blue light. So as I said, so this is very much effective for treating of this circadian rhythm. And again, this what do you call this phototherapy LED setup is made with the pre-nitrate materials. Another use of phototherapy is for the photodynamic therapy. Now, if you look at this figure, so this is the top surface is the skin. Okay, so that is and then we have this below this skin, we have epidermis, then we have a dermis, and then we have a tissue sphere. And if you look here here are the different wavelengths. So the blue light can go till dermis, while the green light can penetrate below this dermis, and the yellow can just go till the tissue, and the red light can go beyond the tissue, and infrared can go further away. Now, with the help of this lights, we can treat or with photodynamic therapy. Now, what happens in a photodynamic therapy? So, what we do is in this type of photodynamic therapy, we use generally for the treatment of this cancer patients with pancreas cancer and all that. So, what we do is we inject a drug. So, these drugs are the photosensitive drugs that is injected on the skin or the affected area, and then a special kind of light is incident on that area. Now what happens here is once you incident that light on this area where you have injected this photosensitive drug, so that will this photosynthesizer will produce active oxygen, and when this is exposed to a particular wavelength, that kills the nearby cell. So if you have if someone has a skin cancer or something like that, so in that case, this treatment is used. So what they do is they inject a drug that is photosensitive in that particular area, and then they expose this to this particular wavelength of light. And when it is exposed, when this cancer cells is exposed to that light, so they are killed or they are destroyed. Now, till now, what we were looking into were in the visible region, that is blue and white. Now we will move towards the ultraviolet areas. So, as you might have heard, that ultraviolet LEDs are used for this disinfection and all that purpose. But most of the UV light coming from sun is absorbed in the outer space. So you might know that we have this ozone layer in the stratosphere. So it absorbs like most of the harmful UV rays. So before going into a UV rays, I will just want to tell you that UV rays are classified into three types. One is a UVA, which is in the wavelength range from 315 to 400 nanometer. The second one is UVB, which is in the range of 280 nanometer to 315 nanometer. And the third one is UVC, which is from 100 nanometer to 280 nanometer. Now, this UVC rays, when the sun rays uh, comes on the earth, but before that, this has been UVC is absorbed by outer space. Now the UVB is mainly absorbed by the ozone layer that is present in the stratosphere, while So some part of UVA that reaches the Earth, while most of them are absorbed by the ozone. Now, since we are not getting any UV light from the sun or from nature, so can we generate a UV source? So, because there are a lot of uses of this UV rays. So, the like UVA rays, they are most common, which causes skin aging and wrinkling, and tanning also. UVB causes sunburns, cataracts, and even it damages the immune system. And UVC rays are the most dangerous, but it is absorbed by the atmosphere. Now, these are the applications where we can use these three UV LEDs. So one is UVA. So this can be used for curing. Then this is UVA is also used for security and bank note. As you might have seen, like whenever you go to the bank and you give deposit your money, they check whether this the currency is fake or not. So they just put into this currency below this UV light and check whether it's fake or it's original currency. Then it is also used for tanning. So it's not used mainly in India, mainly in the European countries. It is mainly used for tanning. Then it's used for sensing, medical applications, lithography, and photocatalysis. Then we have this UVB LEDs, which is used for this medical phototherapy. I will come to this point. Then protein analysis and drug discovery. And the UVC is mainly used for disinfection, and now it has been like largely used for like killing this COVID-19 vaccine. It's also used for sensing for bioagents and DNA. And if you look at this market size, it's a very huge market size, and this is the old data where it was showing like it's around 300 million market, but after COVID-19, it has increased to more than a billion market. So the demand for UV-based LEDs has increased drastically. Like if you wanted to buy this UV LEDs during this March and April, you were not getting the UV LEDs. So like it was the demand was so high. Now, why do we need these UV LEDs? So the conventionally, like people now, like still people are using this UV based lamps. Now, what is the disadvantage of this UV based lamp? First, that is very bulky and it requires a very high power as compared to that of an LED. And the thing is the starting time. Like once you switch on this UV lamp, it takes us some time to get what do you call to a normal position and to get a uh, what a, uh, what should I say? Like it's a constant output power. So the start time is very long. Then it produces a lot of heat. And the main disadvantage here is it's very hazardous. Why? Because all the UV lamps are made from mercury, which is not at all environmental friendly. Then the fourth disadvantage of this UV lamp is it has a broad spectrum. So it has that all the UV lamp, it has a UV plus blue plus lot of wavelengths. But for disinfection, we only require a UV wavelength or a UVC wavelength. Another disadvantage is the shorter lifetime. So you can only use for 1,000 hours and then you have to replace. So, and the thing is, it's very dangerous. So how can we change this from UV lamp to UV LED? So what we can do here is to change from this bulky setup, we can go towards the compact setup. And the only way to make this UV source compact is with the help of UV LEDs. So in this, we make this UV LED with the help of uh, aluminum gallium nitride based three nitride materials, and this is the only material with which you can make ultraviolet LEDs. So the advantage of this LED is very compact. The power consumption is very low. You might know that you only require a cell to operate this type of LED. The start time is instant. Like once you switch on, it will start. And the heat production is minimal. Uh, Heat production is there, but the thing is, as compared to UV C lamp, the heat produced by this UVC LEDs is very much environment friendly because we are not using any mercury, and we have a single wavelength or a very narrow wavelength, uh, and we don't have this multiple wavelength which could uh, which could cause like any other side effect. The lifetime of this type of LED is around 50,000 hours or even more, and it's very much environmentally safe. Now, where we use this UVB LED. So, as I said, that UVB range is from 280 nanometer to 315 nanometer. So, this is mainly used for the person who has this red itchy rashes on his hand, face, legs, and all that. So if you look at this picture, this person or this baby having these red patches. So one way is for treating this is to apply an ointment or medicine, or the quick or the best way to treat this would be with the help of a UVB therapy. So conventionally, we used to have this UV based lamp, this type of lamp was available for treating this type of skin disease. Now, this has been replaced with the very compact and small 3 nitride LEDs. So, earlier we used to have this excimer lasers, which were very expensive and then uh, may have some side effects. But with this type of LEDs, it's very like safe. If you look at this hand, so this is before treatment. So if you look at this hand, it has a lot of rashes on the fingers and on the palm. And after treating, you can see that it has been. It's very effective in treating this rashes on the skin. So for this type of rashes, for acne we had used UVB, but for this type of rashes we will be using uh, UVB light source. And another very important treatment is psoriasis treatment. Now, this disease, psoriasis, it happens to almost 2 to 4% of the world population. Very much common. So it also happens during the change in the weather condition. Like what happens is this the dead skin that comes out uh, of your skin. Like there will be a lot of scales producing on your skin. So how to treat that? So first, before treating that, what is the reason for that? So what happens is this is usually due to the activate immune cell or a T cell. What happens is this T cell is very much important, like especially in the COVID cases. This we need a lot of T cell, not more, but we need a T cell to generate an antibody in our body to prevent any like viruses to attack us. So like once a COVID it tries to enter our body, the T cell present in our body tries to what do you say make an antibody and try to prevent the attack of COVID. So, but sometimes what happens is this there are a lot of T cell generations in the body, and which causes excessive kill cell production and inflammation. So, how to treat that? The only way to treat that is with the help of UVB and light source. So, when we light this UV light on the skin, it triggers the death of T cells. The best and the effective uh, wavelength that can be used for the treatment of this psoriasis is 305 nanometer LED, while the conventional treatment was done with the UV lamp with the wavelength of 311 nanometer. But this 311 nanometer UV lamp was not much effective as compared to that of a 305 nanometer LED for the psoriasis. So you again, as I said, this UVB and C LEDs, even UVA can be made. It's always made. They are all made from 3 nitride metals. Now, this is the major thing that I would like to focus here is the UVC LEDs for disinfection. Now, as you all know, that we are like the whole world is going through a pandemic due to this virus, and how can we treat that, or how can we disinfect that virus? So one way is with the help of the chemical that we are using, like we use like spraying and all that. Another one is, or the best and the effective way is with the help of UVC light. Now, UVC, as I said, uh, are made or UVC light source are mainly made from this mercury lamp, or it can be made with the help of the LEDs. But in India, most of these UVC sources are made from this mercury lamp. As I said earlier, this type of mercury lamp are very harmful, and secondly, uh, the cost is high. The third is it has a very shorter lifetime. So this has to be replaced with the LEDs, which has a longer life and are much cheaper. Now, how does it work? So if you look at here, so this is an what do you call it, RNA, and when the light is incident on this, so it changes the RNA, breaks the RNA, and it deactivates the further growth of any viruses. So UVC light deactivates bacteria, virus, and other microbes by breaking their DNA. These microorganisms lose their reproductive capability and become inactive and no longer harmful. So what will happen is, once it deactivates, so there will be no reproduction of virus or bacteria, and hence you can sanitize them. The best wavelength suited for the what do you call deactivation of viruses and bacteria is 265 nanometer, and that can be made with the help of UVC LEDs or the 3 nitrate based LEDs. So take an example for this bacteria. So if you look at this image, this bacteria, so bacteria has a cell. So it has a cell wall, and below that wall there is a blue line which is a membrane, and inside this cell you have this a cell nucleus, this green color one, which has a DNA and a RNA. Now, when you use like a chemical disinfectant like chlorine or ozone, what happens is this type of disinfectant, it only breaks the outer wall of the cell membrane, but it doesn't penetrate inside. While for the UVC light, it can easily penetrate inside the cell nucleus, and it can damage both RNA and DNA. So UVC irradiation. So what it does is modifies the RNA DNA structure in the cell. It means uh, co- it what you deactivate it. What it does is it uh, sanitizes or it kills the bacteria. So inactivation blocks cell growth by stopping cell division. So there will be no further cell division. So or there will be no reproduction of further reproduction of bacteria or viruses, and hence the sterilization will be. So this is another image where you can see the use of this UV LEDs. So if you look here, so this is a colony of the bacteria or the viruses in this petri dish, and this is and you can see with the naked eye like whether how many viruses are there or not. So what we do here is we treat this petri dish this sorry bacteria and for viruses UV LEDs, and after that what we can see is large grain size, and then it will all the viruses or bacteria they are deactivated. Now, as I said, that this has been used for the sterilization purpose. So you can see currently most of them are using this UV based. So for COVID treatment in the hospitals and for like after the patient has gone or recovered, they sanitize the hospital with the help of this PC lamp. So if you look here, these lamps are very like big, very bulky, require a wheel and all that. It's very heavy and it has a very short lifetime. Then the main thing is the toxicity. It has a mercury. Now it's a time to replace this UV lamps with the LEDs. Now, now like still it's in a we don't have a commercial big sanitizing system, but now we have a small sanitizing unit like this, where we have a small rod with the arrays of UVC LEDs, which are used for the disinfect. So this is a small handheld UVC LED source where this person is trying to disinfect this toothbrush with the UVC light. Hence, so this is one of the use of UVC light source. So till now, what we have seen here is the use of 3 nitride based LEDs for the biomedical application, from like acne till like cat disease to sterilization, even cirrhosis. Now, that if we look at the deactivation time, like how long does it take, or the how much exposure, and like how long we should expose a particular area to disinfect the surface. If you look here, these are the bacteria like Dio Legionella. So the disinfection time will be only 5 seconds with the UVC LEDs. E. coli would be around 8 seconds. Then these two bacteria, this one, Basilicus, it has a larger, it takes a longer time, so more than 30 seconds. Then there are new viruses, this coronavirus, this can be disinfected in less than 10 seconds. So this is very effective for the sanitization of rooms or places or even mobile phones, like once you go out and come. So this is a very good source for sanitization. And there are other viruses also. Like the maximum time taken by the virus for disinfection here is around 85 to 90 seconds. It can also be used for vegetables. Like now, due to this corona, a lot of people they go to the market and like they bring the vegetable, then they put in a salt water or keep in broad daylight for like around half hour, 2 hours, 3 hours. So rather than that, the best way is to use the UV LED. Just keep your food, vegetables, and everything under the exposure of this UVC LEDs, and the disinfection can be done. Now, till now, I had focused mainly on the light source for the biomedical applications like disinfection, then psoriasis, SAD, acne, and all that treatment. Now, I will be using a different device, not LED. This is a HEM. HEM stands for high electron mobility transistor. This is again made from these three nitride materials. This is aluminum gallium nitride and gallium nitride. Now this is something similar to that of your MOSFET. No? You have this source, drain, and gate. Similarly, this HEM devices, it's a similar like thing. The only thing is here we have a substrate, we have a gallium nitride layer, and then a algan layer. Then we have three contacts. First one is here. It can be either a source. Here there will be a drain, and in between gate. So what we do is we make a sensor out of this type of device. So this is a sensor or a biosensor. This is called for a glucose detection or the sugar detection or a diabetes. Now this is your hand device. So here is your one source, here is your drain, and here is the area where is a gate. And in this gate, what we have done is we have put this nanorods. So here it can be a zinc oxide nanorod array or scandium oxide film. And on this film, what we do here is we pour this enzyme. Enzyme can be this glucose detection. So there will be an enzyme. You take blood out of your body and then just you put it here and then apply a voltage and see the current. So if you look here, there's a change in current. Like if we are not applying any enzyme, so if you look at this white black circles, so if we are not applying any what do you call enzyme, then the concentration, if we change the concentration also, the current will almost remain flat. But with this enzyme, if we change the concentration, and you can see that the current increases. So once you get an increase in current, it means there is a presence of glucose, and then you can realize, okay, now this person is having a sugar or so much sugar. So that can be calibrated, and you can make a portable device to check whether the person is having a sugar or not. The main advantage here is like currently people use this glucose strip, but here what you can do is you can just, once you have this, then you can just clean it with some particular solution and reuse it. So you don't have to like buy again and again strips. So another thing where we use this is for the prostate cancer. So this prostate cancer is most common cancer of death among the men, especially in the US. Like 1 in 6 men will be diagnosed with prostate cancer during his life. The most commonly used serum marker for diagnosis of prostate cancer is prostate specific antigen. And prostate cancer can be often be found early and testing by the testing amount of PSA in the patient. See, the most of the cancerous patient, they die early is due to the late diagnosis. So if we are able to diagnose that cancerous cell earlier, that would be very much effective. So generally, the technique that is used for this for the detection of this cancerous cell, PSA, is very expensive and it takes time. So what we have done is, what the people have started doing is they are using this algan based HEM for the detection of this cancerous cell. So first the antibody functionalization is done on a gold gated algan HEM device, and This is very much ineffective for detecting PSA at a low concentration level. The hem drain source current shows a response time less than a 5 seconds, very fast. So within a first second, you can know like whether it's whether person is having a cancer or not. And this device could detect a range of concentration, like very less, like if 1 microgram per ml to 10 pg per ml. So like it's a lot, like, like very small range to very high range. So this is a very good way for getting this or to detecting this what do you call cancer. Now how it is done? Look here. As I said, this is a top view of the hand devices. Here you have a source. Here you have a gate in between, and then here you have a drain. Now what you do is this here we have a bone surface, and over that we put a PSA antibody over it, and then we put an antigen uh, from like person's blood or something like that, and then what we do is we pass a current and see like over a time what will happen. And if you can see that accordingly, we can just determine whether the person is having cancer or not. So with this, I would like to conclude that free nitride has been used or has been become a part of our daily life. Like we are mainly using this free nitride based materials like LEDs, even for UPS, power transistor, like the chargers, like the mobile chargers. Now you get a very small chargers. The whole device is made from gallium nitride. So it's like it has made the devices smaller. If you compare, like if you used to buy the chargers earlier, like 10 years back, it's that used to be very big with a like a huge size. But now it has been made small with the help of these 3 nitride devices. Now, within what I believe is like in 5 to 6 years, now this 3 nitride materials will be used for the biomedical application. And it can be, then it will be related or can be interconnected with the IoT system to make it a smart system. Like you can use this what do you call disinfection room, like if you want to sanitize this one room, what you will do is you will put a LED, and as you know that UVC is very much harmful to you, so what you will do is you can just go to like if you are, you can just close the door, go outside, and with your mobile phone activate the LEDs and disinfect that room, switch off that LEDs, and then come back to the room. So now you as a faculty, you can think of a lot of applications of using IoT, 3 nitride materials for the IoT purpose, and especially since we are going through this dark era of pandemic, and here like sanitization is very much important, and that can be only done in the best way with the help of UVC LEDs. Okay, so with this, I would like to thank the organizers for inviting me for the talk. And if you have any questions, please let me know.
Thank you, sir. Thank you, Dr. Manush Matthew. Any participant, if you want to ask something?
Hello.
So
Yeah.
Sir, I have a question.
Yeah.
Myself, Hari Sharma from Engineering College, Ajmer.
Yeah.
Sir, that UVC light is used for disinfection. So, is it harmful for mobile camera or not? If we are disinfecting our mobile phone?
No, it's not harmful for mobile camera. It's harmful for skin. So usually what happens is like if you have, if someone have a cut on his skin, right? And if it is exposed to UVC light, it causes cancer. So for this, what you have to do is you have to close the room and turn on the light so that the bacteria and everything get disinfected, and then you can just switch off and come in. So for this, I think IoT would be a good We
Yes,
can
sir.
use IoT platform to
Yes,
switch on and
wireless we
off.
can control. Wirelessly we can control with this.
Mhm.
Okay, thank you.
Sir, I have one question, sir.
Yeah,
Hello,
yeah.
myself Deepak Jhamar. So I wanted to know कि whether for disinfection does intensity play any role?
Yes,
Means,
yes, yes. Intensity also plays a role. But it's like what happens is wavelength is important. Like if the intensity is little bit less, what
yeah.
will happen is you have to raise the exposure time. That's all.
Hmm.
Like what happens is suppose it said like at particular like at 265. We'll go to that side.
Yeah, 265 nanometer.
Yeah, yeah. So like
Yeah.
here we have this like this coronavirus. This is SARS-CoV-2. So
Yeah.
here it takes like less than a 10. So here intensity matters. Like if the intensity is
Because
less, then this will be around 20 nano, but it will surely disinfect. Wavelength is very much important. But if the
no,
intensity is less,
because
the
only
time taken will be more.
two parameters are there. One is wavelength and another is exposure time. But
Yeah.
I couldn't see intensity, the role of intensity here.
So intensity will be depending on the exposure, like the exposure time will be depending on the intensity also.
The total quantity, okay, that depends on exposure time. But the intensity, light intensity at particular instant, what is the light intensity? Like laser beam or the, it should be highly concentrated beam or it may be scattered
No,
light also.
no, it's not need to be concentrated because it's a LED. So here there will be no concentration, but it will be diverge. So
Hmm.
divergence would be good because here that light should be exposed to the maximum area in this case.
Yeah.
If you have a laser, in that case, it will be focusing on a particular point. This is the issue. So here we don't need a laser, but we need a broad source or a broad that can cover more area.
So it is the frequency which will break the DNA and RNA
Right, right,
and
right, right, right.
chain, it
What
will
we
break
did
it.
is I tested with this. So we have this one lab, CTG lab, that is Central Testing Agency or something like that in
Hmm.
Jaipur.
Yeah.
They do this for E. coli. So I gave my bottle, 1 liter bottle, and there I fixed this, what do you call, a UVC. I should have put that image. Sorry, I couldn't do that. So we gave that, and what we found that the water, they filled that 1 liter bottle with this, what do you call, E. coli bacteria.
Yeah.
And then he exposed that, and then I put a UVC LED, not with the 265. At that time, I didn't have that 265. I had 275 nanometer. And he put that, and he observed the readings after 5, 10, and 15 minutes.
Yeah.
So what he found that after 15 minutes, all the E. coli bacteria were dead. But before, like, yeah, after 2 minutes, what do you call, the number of bacteria reduces to around 20% from
Hmm.
100%. But in order to completely remove, it takes some more time. So this was a 1 liter bottle.
Just a small question, sir. I would like to add something.
Mhm.
Why we cannot cross this 265 nanometer? Is there any special thing? Can
Yeah,
we go for higher
yeah.
frequencies?
The thing is, what I said is a band gap. We'll
Hmm.
come to the thing is, we can go, it's not a problem, but this comes a band gap here. Now, if we look here, so 265 is coming somewhere here.
Hmm.
So this wavelength, this band gap is high. Comes around 5.2 electron volt.
Electron volt
Okay,
energy.
right.
Hmm.
So the band gap is much higher. So it's somewhat acting like an insulator. Okay. So what will happen is it's very difficult to, like, the resistance of this device would be much higher, and it will produce a lot of heat.
No,
But
we go for millimeter waves or other higher waves.
right.
Means
So
more than that.
yeah. So but
Sorry,
the
not
sources will
millimeter,
be
but
reduced.
more than that, like light
Yeah.
frequency,
The
ultraviolet.
thing
Yeah.
is, but if you want to do with a semiconductor, you have only one material left with it, and there is, I
Hmm.
think, there is no other source. Like if you look, there are no particular UV sources Like if you have one laser that comes in 195, that is argon freon laser, I think.
Yes.
Okay. And then there is no source. Now, how will you do? Now, laser has a what you have to call as a fixed spot area, or what do you call it? It's a current source. It won't
Yeah.
be like a divergent, right? But in this case, you need that. But people are working on that, and now, if I think the thing is,
This is the gap energy. Basically, it is departing the gap energy.
right,
Energy is,
right. We are playing with this band gap,
it is carrying the
so,
energy actually,
right?
and that is
So,
destroying this bacteria.
sorry, can you repeat
This
it?
energy is there, which is destroying this bacteria.
Yeah. So, thing is the wavelength.
Yeah.
What happens is the penetration. It should penetrate inside that bacteria. That is much important. So, if you
Mhm.
look here, this UVC light. If you look at this, if
Yeah.
I use a simple blue light, it won't penetrate inside the cell.
But it is not damaging the other part of that, other cells in this.
Yeah, so it doesn't matter. But the main thing is the nucleus. If the nucleus is dead, RNA, DNA is dead, nobody can reproduce. Simply. Here, if you look, chlorine damages only the walls of the cell, ozone. But here, it
On
will
the
like
surface is
completely
intact and
destroy
it
it.
will cross that. It will cross
Sorry?
the layer, surface layer.
Yeah, yeah.
Yes.
So if you look at the skin also, no? Like I
Yes.
had one image I showed you. Sorry. Yeah, here. Look at
Yes.
the wavelength. Like all the light doesn't go inside the skin, our skin. Like if I want to treat only the surface of the skin, then I don't need this type because this will damage below the skin. So in that case, only blue light. So we have to take care of that. So wavelength is very much important.
Yes.
Okay.
Okay. Thank you, sir.
Excuse me, sir. I am
Yeah.
having query.
Yeah. Please.
Sir, suppose if you have talking about prostate cancer detection using biosensor, so before applying to any human body or directly application to human life, how this kind of biosensor is first tested, and what would be the duration of this biosensor or reusability of this kind of biosensor?
See, it has been commercially used. I don't know exactly what, like how long it is takes, but for the cancer treatment, people are using this. So the doctors, they usually now they inject this at a affected area. They inject this. Earlier, they used to do this. No? What do you call radiotherapy and chemotherapy? So what they in a chemotherapy, what they do is they inject a particular medicine in that area and export that to a radiation, and that damages that particular area, right? So similarly here also, for the like what do you call this one, uh, this one, yeah, prostate one. So this one, in this image, this is not inside the body. Here what they are doing is they are taking the samples from the blood and then they are detecting.
Okay.
Okay, this is not inside the body. This is outside. Like
Okay.
what you do is the normal procedure for this prostate cancer is taking the biopsy. Here we don't do the biopsy. We take the blood sample and then we do that. So biopsy is like a time-consuming process because you cut the piece and then do all that. It takes a long time. Here you just take the blood and then you can detect.
Okay, so when the blood has been taken and this testing has been done, and if the severity is more, then how it would be recognized through that blood sample?
So there will be a particular see what happens is you put a particular antibody. So for this prostate, you first put an on a gold layer, you put the antibody and then you put the antigen. So if there is a cancerous cell, then it will attach. If there is no cancerous cell, it will not attach and you will not get a current.
Okay. Okay, and then after there is any specific measuring after if the antigen has been making that bond with that other antibody parameter, then what would be the final decision has been taken as a severity of that cancer penetration?
Yeah, so what they do is they usually make the system and they calibrate it. Like they make it like if you have this much of current, then so much of them would be there. So accordingly, then they will start the treatment, or they may further give medicine or something like that. So this is where it can be done.
Thank you, sir.
Yeah. Any other questions?
So if anybody have any question, sir, I think that there is no more questions now.
Okay.
So Manish sir, I thank you very much for coming and enlightening us for this wonderful session and sparing your time because you was busy and I made a special request to you to come and speak. So thank you very much, sir. Thank you very much all the participants. So I mark the end of this session here, and as our previous session was postponed, so we'll be connecting back at 4 o'clock for the session which was postponed this morning. Thank you very much, Manish sir, again.
Okay. Thank you very
very
much.
all the participants. Thank you.
Thank you.
Manish sir, if you are there,
Yeah.
sharing PPT is one request which is coming from the participants.
Okay.
So if you can please,
I will mail.
Right.
I will mail to Agrawal ji. Okay.
right, sir. Thank you.
Okay.
Thank you.
Okay.
Shiva, SHIVA. हाँ